The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. This week's episode is titled, Are Insurers Turning the Financial Corner? Yes, but there is more work to be done. The second quarter earnings season is now essentially in the books, and if you step back and look across the major publicly traded health insurers, there is a pretty clear message emerging. The industry is recovering, not booming, not back to the good old days, and certainly not out of the woods yet, but recovering. And frankly, that's a pretty important change from where this industry was 6 months or even a year ago. United Health, Elevance, CVS, Cigna, Humana, Centene, Molina, and others have spent the last couple of years dealing with some pretty extraordinary problems. Medical costs exploded. Medicare Advantage utilization surprised just about everybody. Medicaid went through the unprecedented post-pandemic redetermination process. Exchange markets became increasingly difficult. Drug costs, particularly specialty drugs and GLP-1s, created another layer of pressure. And then there were the companies themselves. A lot of health plans simply got their forecasting wrong. They lacked financial discipline. And I'm going to say something that I have said repeatedly in this podcast and in my healthcare reform series. The industry wasn't alone in getting it wrong. Wall Street got it wrong too. Analysts repeatedly underestimated medical cost trends. Management teams repeatedly told investors that things were under control right before they weren't. And investors repeatedly rewarded growth strategies that, in retrospect, were not necessarily producing sustainable earnings. So what has changed? Well, the biggest change is that insurers appear to be shifting from a growth at almost any cost mentality to something much more disciplined. They're looking at every line of business, every market, every product, every member, every service operation. And increasingly, they're asking a very simple question. Does this business actually make money? And if it doesn't, they're willing to do something that health insurers historically haven't always been very good at doing. They're willing to walk away. So today I want to look at what the second quarter tells us about the financial health of the industry, and more importantly, what it tells us about where the industry is going. And there are some very interesting signals. With that, let's take our first of 3 breaks today. When we come back, we'll look at the overall financial picture and why the numbers from United, Elevance, CVS, and Cigna, and more tell us that the recovery seems to be real. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we hope you are enjoying this episode. This week, we're covering the second quarter financial results for the major health insurers and what those results tell us about the industry's financial trajectory. I promise next to discuss the overall financial picture. And here's my bottom line. The financial recovery looks real, but it is not uniform and it is not necessarily durable yet. Let's start with the big diversified companies. United Health Group remains the industry's financial heavyweight. In the second quarter, United reported roughly $112 billion in revenue and approximately $5.5 billion in profit. That's an enormous amount of money flowing through the organization. But what's particularly interesting about United isn't simply the size of the numbers, it's the composition. United has spent years building Optum into a massive healthcare services enterprise, pharmacy, care delivery, technology, analytics, and other services. And that diversification matters because when the insurance business gets hit, the services businesses can provide another source of earnings and cash flow. And that is one reason the business model of United Health looks fundamentally different from that of a traditional health insurer. Now, I will tell you that's not always the case. Recently, United also saw major problems with its services business. But in general, the more diversified you are, the more you can go up against bad times and weather them. Then you have Elevance. Elevance generated roughly $50 billion in quarterly revenue with earnings around $1.5 billion. There were positives. Premium yields improved. Carelon, the services entity there, continued to expand, but there were also some very important warning signs. Membership declined in Medicare Advantage, Medicaid, and commercial risk. And that's important because we're seeing a broader industry phenomenon. Membership is no longer automatically synonymous with success. For years, health plans were rewarded for adding members. More lives meant more revenue meant more scale. But we've reached a point where the question is different. If you add 100,000 members and lose money on those members, congratulations, you successfully lost money at scale. That is not a strategy, it's a problem. And that's why I think the industry is entering an era of what I would call precision assessment. Health plans are getting much more granular. They're looking at profitability by market, product, county, member, population, and service. They're asking where they have pricing adequacy, where they don't, where medical costs are predictable, where they aren't, and where they have the operational infrastructure to actually manage the risk and the medical loss ratio. CVS Health also had a strong quarter. Revenue was approximately $106 billion, with total profit approaching $3 billion. Aetna's, CVS's insurer profitability improved substantially. That is significant because CVS has been under enormous pressure from investors to demonstrate that its healthcare strategy can actually generate sustainable returns. But there is a fascinating contradiction here. The quarter was strong, but investors remain worried about the future of Caremark, CVS's pharmacy benefit management business. And that illustrates one of the biggest themes in healthcare right now. A business can be performing well today while investors are simultaneously questioning whether the economics of that business or pieces of that business will work 3 years from now. Cigna provides another example. Cigna reported almost $72 billion in revenue, up about 7% year over year, with profit of roughly $1.7 billion. And again, the story is Evernorth. Cigna has positioned its healthcare services operations as an increasingly important part of the company's economics, and investors have recognized that. Evernorth's pharmacy and specialty management businesses remain major earnings contributors. But again, the PBM industry is entering a period of enormous change. Congress is looking at it. The FTC has looked at it. Employers are looking at doing things differently, and drug manufacturers certainly are as well. So the economics of PBMs 5 years from now may look very different from the economics of PBMs today. And that gets us to a very important point. The industry is recovering financially overall, while simultaneously being forced to reinvent itself. That's a paradox. The quarter looks better, but the future operating environment may actually be harder. And nowhere is that more obvious than Medicare Advantage right now, which is where we'll go next. With that, let's take our second break. When we come back, we'll look at Medicare Advantage, Medicaid, and the exchanges, and why the business lines that drove so much insurer growth are now forcing executives to rethink what growth actually means. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to the Healthcare Labyrinth Podcast. I'm Marc Ryan, and we hope you're enjoying this episode. We're talking about the second quarter financial performance of the major health insurers. We just looked at the overall financial picture. Now let's get into the lines of business for these insurers. And let's start with the elephant in the room, Medicare Advantage. It would be hard to find another line of business that has caused more headaches for health plan executives over the past 2 years than Medicare Advantage. The good news, things are getting better. The bad news, things aren't good enough yet. The industry was hit by unexpectedly high utilization coming out of the pandemic, and that was really clear in Medicare Advantage. Inpatient admissions, outpatient procedures, physician services, specialty drugs, expensive therapies. The problem was simply that costs went up. The problem was that the industry didn't project adequately for those increases. And when they added a whole bunch of growth in membership on top of it, it made things even worse. So insurers entered 24 and 25 with margins that were effectively squeezed between inadequate revenue and higher than expected medical costs. Now we're seeing pricing catch up. The 2026 Medicare Advantage pricing environment is much more reflective of what insurers have actually been experiencing. Utilization is becoming more predictable. Some supplemental benefits have been redesigned. Plans have become more aggressive about benefit management. And executives are saying that medical cost trends are now being incorporated into pricing assumptions rather than arriving as complete surprises. That's a big difference, but let's not get carried away. Medicare Advantage has not returned to its historical profitability. Utilization remains elevated. CMS payment changes continue to constrain revenue growth. The transition to the V28 risk adjustment model continues to affect plan economics. And then, of course, there's star ratings. Stars remain enormously important because the difference between being above and below key thresholds can have a significant impact on the economics of an MA contract. So when you put all of that together, the message from management is pretty consistent. 2026 is better, but they're still cautious about 27. And I think that caution is appropriate because the industry has just learned a very expensive lesson. Don't assume that a temporary improvement in medical costs represents a permanent change in the trend. And that lesson carries directly over to Medicaid. Medicaid may actually be one of the more interesting stories of the quarter. The massive eligibility redetermination process following the end of the public health emergency caused enormous disruption. Millions of people were disenrolled, membership shifted, plans had difficulty predicting who would remain enrolled, states struggled with budgets, and health plans struggled to understand what their Medicaid populations would look like going forward. States did not adequately fund for the increased risk that was seen when enrollment dropped dramatically, but much of that disruption now appears to be behind us. States have also increasingly recognized that medical costs are higher than they were several years ago. That has translated into rate actions in many markets. Molina, for example, has been pointing to relatively stable Medicaid medical cost trends and favorable rate actions. Centene has also talked about improving predictability. So ironically, Medicaid may be becoming easier to manage in the short term. But here comes the giant asterisk. The federal policy environment is changing. The reductions in projected Medicaid spending over the coming decade are enormous. And ultimately, someone has to absorb those reductions. States will react and likely do a combination of things: reduce eligibility, reduce benefits, reduce provider payments, and squeeze managed care rates. And that means today's Medicaid stability could eventually give way to another period of significant pressure. Then there are the exchanges. And I think this is where the industry's new philosophy becomes particularly obvious. Health insurers don't necessarily want to be the biggest exchange player anymore. They want to be the most profitable one. That's different. Molina, for example, has continued reducing its exchange exposure despite producing strong overall financial results. Why? Because membership isn't the objective. Profitable membership is the objective. And that may be one of the most important lessons coming out of this earnings season. The healthcare industry's obsession with scale is being replaced by an obsession with unit economics. And frankly, it's about time. With that, let's take our final break. When we come back, we'll look at commercial insurance, the PBM problem, healthcare cost trends, and I'll give you my bottom line assessment of where the industry goes from here. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com. Your go-to source for healthcare news.
Welcome back to the final part of this edition of the Healthcare Labyrinth Podcast. I'm Marc Ryan, and we're wrapping up our look at the second quarter financial performance of the major health insurers. We've talked about the overall recovery. We've talked about Medicare Advantage. We've talked about Medicaid and the exchanges. So let's finish with the piece of the business that may actually be the most boring, but also the most stable: commercial insurance or employer coverage. Employer-sponsored insurance continues to be one of the industry's most predictable businesses. Membership isn't necessarily exploding. In fact, commercial enrollment has declined modestly for some insurers, but profitability has generally been solid. And there's a reason for that. Large employers provide a relatively predictable population. The claims patterns are more familiar. Pricing can adjust, and insurers generally have more flexibility than they do in government programs to pass on what are heavy trends in healthcare. Commercial insurance probably isn't going to be the industry's next great growth engine, but it remains an important financial anchor. The problem? Healthcare costs. They're still too high, and while plans can pass on many of those costs, businesses are passing on more and more of those increases to employees, who in turn are facing a huge crisis in affordability. That does not make for a healthy system for anyone. And that's the issue I keep coming back to. The industry's financial recovery does not mean the underlying healthcare cost problem has been solved. In fact, insurers are working around the cost problem and in effect creating even more problems in terms of affordability and coverage for ordinary Americans. Healthcare costs continue to grow uncontrollably across the board. Take a few examples. Behavioral health utilization continues to grow. Specialty pharmaceuticals continue to transform the cost structure. And then there are GLP-1 drugs. The GLP-1 story may ultimately be one of the biggest wild cards in healthcare. These medications have enormous potential to improve health and reduce downstream costs, but in the short term, they're expensive, and insurers have to figure out who should get them, for what indications, under what conditions, and how those costs should be incorporated into premiums. At the same time, the pharmacy benefit management model is undergoing a fundamental political and economic reassessment. That matters enormously for United, CVS, and Cigna, the big three PBMs, because their services businesses have become increasingly important contributors to overall earnings. So we may be witnessing something pretty profound. The health insurer of the future may not really be a health insurer in the traditional sense. It may be a combination, as we see with the biggest guys, of an insurer, a pharmacy company, a care management org, a provider organization, a technology company, a data company, and increasingly an intermediary between patients, providers, employers, pharmaceutical companies, and government. That's the model the big guys again are pursuing, but there is danger. The more complicated these organizations become, the harder it becomes for investors and, frankly, regulators and consumers to understand where the profits are actually being generated. And that leads to greater and greater government scrutiny when these companies get so big. And that's going to matter down the road because the political scrutiny of these organizations won't go away. It will only increase. So where does that leave us? My conclusion is pretty simple. Yes, the health insurance industry appears to be turning the financial corner, but I don't think we're returning to the heyday of the health insurance industry. We're entering a different era, an era where growth is less important, an era where membership for membership's sake is increasingly viewed as a bad strategy, and an era where health plans are willing to leave markets, drop products, reduce enrollment, redesign benefits, renegotiate provider arrangements, and scrutinize every component of the cost structure. That's not necessarily bad news. In fact, it may be exactly what the industry needs, but it comes with a catch. Health insurers can become more financially disciplined. They can improve pricing. They can improve They can become more sophisticated at managing risk. But again, none of that fundamentally solves the underlying problem. And until we do that, we still have a coverage and affordability problem. American healthcare is still extraordinarily expensive, and if medical cost trends remain elevated, eventually those costs go somewhere. So I'm cautiously optimistic about the health insurance industry, but I'm not declaring victory yet. The industry has stabilized. It has begun rebuilding margins, and management teams sound much more confident than they did 6 months ago or a year ago. But the next challenge is much harder. Can the insurance industry maintain those margins while the entire healthcare system around them continues to change? Can they maintain growth as costs drive even greater dysfunction in the system and the greater and greater loss of coverage and fewer affordable plans? That's the question I'm going to be watching, because if the last few years taught us anything, it's that healthcare executives, investors, policymakers, and frankly, all of us need to be very careful about assumptions. That's what the Healthcare Labyrinth is all about. Just when you think you've found the exit, another corridor appears, and we have no idea where it's headed. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening. If you enjoyed this episode, be sure to subscribe and share it with colleagues interested in healthcare policy, economics, and the increasingly complicated business of American healthcare. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I'm Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.